My name is Dr. Blake Bodendorfer. I'm an orthopedic surgeon specializing in sports medicine, shoulder, elbow, hip, and knee. Just started here at Cass Health recently. My wife is an orthodontist. We live in Omaha, and we have a pet dog named Bailey. So I'm originally from Missouri and went to undergraduate at Drury University. Studied biology and chemistry there, as well as business. Went on to medical school at the University of Missouri in Columbia. And then I went on to residency at Georgetown in Washington, D.C. And then most recently went on to complete a sports medicine and shoulder surgery fellowship at Rush in Chicago. I really enjoy cycling and Peloton. My wife actually won a Peloton for us about a year ago, so we've been using that a ton. We also enjoy outdoor stuff like hiking, camping. Back in August, we just completed a 4-day hike in Peru, hiking to Machu Picchu on the Inca Trail. I've always been a Packers fan, so they are the team that I cheer on the most, but I've kind of developed kind of a bandwagon fan reputation for moving all over the country. So I love the St. Louis Cardinals. I love the Blues from growing up in Missouri. Also really enjoy watching the Washington Nationals and Washington Capitals. And then I was a team physician for the Chicago White Sox and the Bulls, so I can't help myself watching them as well. So the majority of the patients that I see are 12 or older, but I do see children that are younger than that if they have a broken bone or a fracture. A common misconception that patients have when they go to see an orthopedic surgeon is that they're going to see an orthopedic surgeon and they're going to recommend surgery, but actually the majority of the things that I see don't require surgery and can get people back sooner. That being said, some things do require surgery, so I can offer patients anything from conservative care, whether that's injections, anti-inflammatories, physical therapy, to complex repairs and reconstructions or even replacements. So my first exposure to orthopedics was as a 7th grade wrestler. I broke my leg, and fortunately it wasn't necessary to have surgery for that, but I just loved the idea of being able to return people to the activities that they love and enjoy, and that was kind of expanded on later on in college when I was able to shadow orthopedic surgeons, and I just loved being able to diagnose and treat conditions with straightforward solutions to provide people pain-free living and getting them back to the function and activities that they enjoy. So the most important things for patients to kind of have ready to be able to explain to me is where it hurts, what their functional limitations are, what they've tried, and that might be medications like Tylenol or anti-inflammatories, might include physical therapy. If there's been imaging like x-rays or an MRI or a CAT scan, that would be something that's important to bring to the appointment if it wasn't previously done here at Cass Health.